It's a wet, damp environment, so there's the typical slip and fall hazards like anything, so they got to be careful. A lot of people are wearing rubber boots, and so rubber on water isn't always a good mix. It's safer than a lot of other things, but it's important that they wear appropriate protective equipment, keep themselves dry, avoid slip and falls if they can. With any water exposure, there is the potential for bacterial and fungal contaminant, especially of wounds. And so if you get a cut or a scrape, make sure you wash it out well, and if it's deep, certainly get seen so you can have it professionally irrigated and sewed if necessary and bandaged. And then potentially even antibiotics for prevention of infection, but that all is kind of a case-by-case scenario. Certainly we saw in the last flood a lot of water exposure, and it was the runoff chemicals and other things that were in the water that were creating skin reactions, and so we saw a lot of unusual rashes that we weren't necessarily able to identify, but a lot of that ends up being just local care, maybe some topicals such as steroids if it looks like it's just a straight irritation versus infection. And so I think probably the key thing is that if you have any kind of exposure and you have a change in your skin, or if you have an injury, get seen, especially if you feel like it's serious. The mold situation, people always worry about toxic molds and things like that. A lot of exposure to mold is actually more of a hypersensitivity as opposed to an infection. Certain people can work around molds in basements and damp areas more than others, and it's more of an allergic reaction in a lot of cases, and so they develop some respiratory symptoms just like you would with any other allergy, whereas others can work in that environment with really little trouble at all. If you're immunocompromised in any way, you want to avoid, it's probably not the best place for you to be working. Even if you want to help, find other ways to help. If you're a chemotherapy patient or other immunosuppressive reasons, you want to look to contribute maybe with food preparation or financially or something of that way. But otherwise, mold, keeping things dry is important. So if you have dehumidifiers, if you've been exposed to water, or if your basement is flooded, dehumidify, open up airways so you can get air movement through any kind of damp environment. But it's where there's water, there will be mold, and so remediate that as well as you can. And it might be a good idea to let the specialists do it, because there are companies out there that can assist you with that. So there'll be fewer injuries, there'll be less garbage. If you remember, there were just piles and piles and piles of damaged housing material that they ended up having to dispose of, and all of that has potential for infection and tetanus and things like that. But that's the same wound care rules apply. Wash the wound, a little antibiotic ointment for superficial wounds and scrapes. If any signs of infection, redness, swelling, pus, by all means get it seen. And if it's a deep wound, then certainly come in and let us evaluate it to determine if it needs a more professional repair. Otherwise, ankle sprains are ankle sprains, and slip and falls and injuries, and they're all the same otherwise, and we're happy to see those anytime. Tetanus does wane over time, and so generally they recommend a non-exposed update every 10 years. So you should talk to your primary care physician about that just as a general health measure. But if you've been exposed to some sort of contaminated water or dirt, especially with an open wound, generally if it's greater than 5 years, we'll update your tetanus. If it's been within 5 years, you don't need a tetanus update.